Welcome back to the Healthcare Horizons podcast. In today's episode, we'll be diving into the topic of substance use disorders. This is such an important issue because it affects people across all walks of life, and it's something that many of us will encounter, either personally, in our families, or in our communities. Whether you're a clinician, a student, or someone simply interested in understanding human behavior and health, this episode will help you see substance use through a more compassionate and evidence-based lens. We'll unpack what defines a substance use disorder, why it develops, how it's diagnosed, and the importance of empathy in every stage of treatment. So, let's start with an overview. Substance use disorders are conditions that involve the persistent use of substances despite harmful consequences. They cut across every clinical setting, and they often don't occur alone. Many times, substance use disorders are paired with psychiatric conditions like depression, anxiety, or schizophrenia, and even medical disorders. This comorbidity makes diagnosis and treatment much more complicated. Beyond that, substance use can lead to emergencies like withdrawal, delirium, and seizures, all of which require quick recognition and care. The impact is enormous, not just on the individual, but also on families, workplaces, and society at large. That's why best practice calls for empathic, non-judgmental care. Judgment only drives people away from help, while empathy opens the door to recovery. Now, let's explore why people develop substance use issues. There's no single cause, it's usually a mix of factors. Psychodynamically, some people use substances as a way of self-medicating, maybe to escape from depression or emotional pain. Behaviorally, it often comes down to reinforcement. The immediate reward from the substance encourages repeated use. Genetics also plays a strong role. Twin and adoption studies show that substance use vulnerability is heritable. And then there's the neurochemical side. Drugs often hijack the brain's reward system, especially dopamine pathways in areas like the nucleus accumbens and the ventral tegmental area. One really sobering fact: substance users are about 25 times more likely to die by suicide. And when it comes to alcohol specifically, about 15% of people with alcoholism die by suicide. That's why it's so critical to look at the whole picture, including mental health, when treating substance use disorders. So how do we identify addiction in practice? Screening is key. A good strategy is to start with substances people are less likely to deny, and then move toward the more stigmatized ones. You might ask about prescription medications first, then tobacco, then alcohol, and finally illicit drugs. A widely used tool is the CAGE questionnaire for alcohol. The questions are simple. Have you ever felt you should cut down? Have people annoyed you by criticizing your drinking? Have you felt guilty about it? And have you ever needed an eye-opener in the morning? Even one yes can raise suspicion, and two or more is a strong indicator of a problem. Once you've identified a problem, the next step is to think about change. This is where motivational interviewing comes in. The idea is to strengthen a person's own motivation instead of pushing them. For example, if someone says their motivation to quit is a 4 out of 10, you can ask, what would make it a 5? This respects their autonomy while gently encouraging progress. It ties in with the stages of change model. Pre-contemplation, where someone isn't even thinking about change. Contemplation, where they're aware but ambivalent. Preparation, where they're getting ready. Action, where they're making changes. And maintenance, where they're focused on preventing relapse. Now, from a diagnostic standpoint, the DSM-5 defines substance use disorder with a set of core criteria. These fall into 4 big groups: impaired control, social impairment, risky use, and pharmacological features. Examples include using more than intended, unsuccessful efforts to cut down, craving, failing responsibilities, and continued use despite problems. Then we have tolerance and withdrawal, which show up in many cases. A diagnosis requires at least 2 criteria within 12 months, and severity is rated as mild, moderate, or severe. It's also worth noting that we don't call it addiction anymore. Clinically, substance use disorder is the more accurate and less stigmatizing term. Another related category is substance-induced disorders. These include intoxication, withdrawal, and mental disorders triggered by substances. For intoxication, think about it as a reversible syndrome caused by recent use. Withdrawal, on the other hand, is the maladaptive change that comes after stopping heavy use. Symptoms vary by drug type. For short-acting drugs like alcohol or heroin, withdrawal comes on fast and hits hard. For long-acting drugs like methadone or diazepam, symptoms start later but can last much longer. Common withdrawal symptoms include sweating, rapid heart rate, nausea, anxiety, tremors, and even seizures. Finally, substances can also directly trigger psychiatric conditions. For example, sedatives might cause depression when intoxicated or anxiety when withdrawing. Stimulants can trigger psychosis during use or depression when coming off them. These substance-induced mental disorders usually resolve within about a month after stopping the substance, but they can cause real distress and impairment in the meantime. So, to wrap up, substance use disorders are complex conditions with biological, psychological, and social roots. They require careful screening, compassionate interviewing, and evidence-based diagnosis. Above all, treatment works best when it's grounded in empathy and a deep understanding of what the person is going through. If there's one takeaway, it's this: Empathy saves lives. And as healthcare providers, friends, or family, the most powerful thing we can offer is understanding and support. And that's it for today's session on substance use disorders. Stay tuned for part 2, where we'll dive deeper into specific substances, treatment strategies, and real-world clinical approaches. If you found this episode helpful, don't forget to like, comment, subscribe, and share it with someone who might benefit. Thanks for tuning in. And remember, knowledge and compassion go hand in hand when it comes to supporting recovery.